Welcome to today's video about symptoms of pneumonia. What if that lingering cough or sudden fever is more than just a common cold? Could it be something as serious as pneumonia? Each year, pneumonia claims the lives of over 2.5 million people globally, including more than 700,000 children under the age of 5. Pneumonia doesn't discriminate. It affects the young, the elderly, and everyone in between. Recognizing its symptoms early can be the difference between life and death. Do you know the subtle signs that could indicate a serious lung infection? Stay with us as we uncover the symptoms you should never ignore and empower yourself with knowledge that could save a life. By understanding pneumonia's warning signs, you can take swift action, seek appropriate medical care, and protect your loved ones. Let's dive in and arm ourselves with the information needed to combat this silent killer. Please note, this video is for informational purposes only and is not a replacement for professional medical advice, diagnosis, or treatment. Always consult a healthcare provider for any medical concerns. All research information shared here has been verified by researchers. You can find all references to the studies mentioned in the description below. All right, let's break down the key symptoms of pneumonia, starting with the first one you need to know. Cough. When pneumonia strikes, it inflames the air sacs in your lungs, filling them with fluid or pus. This inflammation triggers your body's natural reflex to clear the airways, leading to a cough. In pneumonia, this cough is often productive, meaning it brings up mucus or phlegm. The color and consistency of this mucus can vary: clear, yellow, green, or even blood-tinged, depending on the type of infection. A recent study published in the journal Sensors in 2021 analyzed the characteristics of cough sounds in pneumonia patients. Researchers found that coughs associated with pneumonia had increased loudness in the latter phase and sustained high-frequency components. These acoustic features can help in distinguishing pneumonia-related coughs from those caused by other conditions. It's essential to recognize that a cough persisting longer than a week, especially when accompanied by fever or shortness of breath, warrants medical attention. Early detection and treatment of pneumonia can prevent complications and promote a quicker recovery. Next, number 2. High fever. Fever is a common symptom of pneumonia, often indicating your body's effort to combat the infection. When bacteria, viruses, or fungi invade the lungs, the immune system responds by raising the body's temperature to create an environment less favorable for these pathogens. This increase in temperature is what we recognize as fever. In pneumonia, fever can vary in intensity. Some individuals may experience a mild fever, while others might have temperatures reaching 105 degrees Fahrenheit, 40.5 degrees Celsius, or higher. Such high fevers are typically associated with bacterial pneumonia and can be accompanied by sweating, chills, and general discomfort. Recent research underscores the significance of fever in diagnosing pneumonia. A study published in the American Journal of Medicine in 2023 highlighted cases where patients presented with fever and headaches as the sole symptoms of pneumonia. This finding emphasizes that fever, even without respiratory symptoms, can be an early indicator of the infection. It's also worth noting that in certain populations, such as older adults, fever might be less pronounced or even absent. Instead, they may exhibit confusion or a lower than normal body temperature. This atypical presentation can make pneumonia harder to detect without a noticeable fever. Monitoring body temperature is crucial, especially if you're at risk for pneumonia. Persistent or high fever warrants medical attention, as early diagnosis and treatment can prevent complications and promote recovery. Next, number 3, chills. Experiencing chills can be quite unsettling, especially when they come on suddenly and are accompanied by other symptoms. In the context of pneumonia, chills often signal that your body is mounting a defense against the invading pathogens. When bacteria, viruses, or fungi infect the lungs, they cause inflammation in the air sacs, known as alveoli. This inflammation leads to the accumulation of fluid or pus, making it harder for oxygen to reach the bloodstream. In response, your immune system releases chemicals called cytokines to combat the infection. These cytokines can reset your body's thermostat in the hypothalamus, leading to an increase in body temperature or fever. As your body temperature rises, you might experience chills or shivering as your muscles rapidly contract and relax to generate heat. A study published in the Nature Reviews Disease Primers in 2021 found that 85% of patients diagnosed with bacterial pneumonia reported experiencing chills during the early stages of their illness. This underscores how common chills are as an initial symptom of pneumonia. It's important to note that while chills are a common symptom, not everyone with pneumonia will experience them. Factors such as age, overall health, and the specific type of pathogen causing the infection can influence the presence and severity of symptoms. For instance, older adults or individuals with weakened immune systems might not exhibit typical symptoms like chills or fever. If you or someone you know is experiencing persistent chills accompanied by other signs of pneumonia, such as cough, fever, or difficulty breathing, it's crucial to seek medical attention promptly. Early diagnosis and treatment can significantly improve outcomes and prevent complications. Next, number 4, shortness of breath. Breathing should be effortless, but when an infection takes over the lungs, it can feel like a struggle. Pneumonia inflames the air sacs, filling them with fluid or pus. This makes it harder for oxygen to reach the bloodstream. The body works overtime, causing a feeling of breathlessness even when at rest. Lungs need to expand fully for deep breaths, but inflammation stiffens them. This limits airflow, making each breath feel shallow. The brain detects low oxygen levels and signals the body to breathe faster. That's why people with pneumonia often feel out of breath, even after small activities. A study published in the Clinical Infectious Diseases, 2011, found that patients with pneumonia had significantly reduced oxygen saturation levels, with an average drop of 8 to 12% compared to healthy individuals. This explains why dizziness and fatigue often accompany breathlessness. In severe cases, the body may struggle so much that the lips or fingertips turn blue, a sign of dangerously low oxygen. If shortness of breath worsens or comes with chest pain, it's a medical emergency. Getting help early can prevent complications and speed up recovery. If breathing feels different than usual, don't ignore it. Next, number 5, chest pain. Experiencing chest pain during pneumonia is quite common and can be particularly distressing. This discomfort often arises due to inflammation of the pleura, the thin membranes enveloping your lungs and lining your chest cavity. When these membranes become inflamed, every breath, cough, or sneeze can trigger sharp pain, a condition known as pleuritic chest pain. Beyond pleural inflammation, pneumonia can lead to other complications that manifest as chest pain. For instance, the infection might spread to the pleural space, resulting in a fibrino-purulent exudate, a thick fluid composed of fibrin and pus accumulating in this area. This condition, known as empyema, can intensify chest discomfort and requires prompt medical attention. Moreover, the systemic inflammatory response triggered by pneumonia doesn't just affect the lungs. It can also influence heart function, leading to cardiovascular complications. Research indicates that pneumonia may induce a systemic inflammatory reaction, increasing the risk of conditions like acute coronary syndromes, which can present as chest pain. In summary, chest pain during pneumonia can stem from various factors, including pleural inflammation, the spread of infection to the pleural space, and even cardiovascular complications. Recognizing these potential causes is crucial for timely and effective treatment. Next, number 6, fatigue. Experiencing overwhelming fatigue even after ample rest can be a significant indicator of pneumonia. This exhaustion stems from the body's immune system releasing inflammatory cytokines, such as interleukin-6 and tumor necrosis factor alpha, to combat the infection. These substances, while essential for fighting pathogens, can lead to feelings of profound tiredness. A study published in the European Respiratory Journal, 2011, observed that patients with community-acquired pneumonia exhibited elevated systemic cytokine levels, correlating with increased fatigue. Additionally, pneumonia can impair oxygen exchange in the lungs, leading to reduced oxygen levels in the bloodstream, a condition known as hypoxia. This decrease in oxygen delivery to tissues and organs can further contribute to sensations of fatigue and weakness. The Cleveland Clinic notes that hypoxia is characterized by symptoms such as confusion, restlessness, and rapid heart rate, all of which can exacerbate feelings of fatigue. If you or someone you know is experiencing persistent fatigue alongside respiratory symptoms, it's crucial to consult a healthcare provider promptly. Early detection and treatment of pneumonia can significantly improve recovery outcomes. Next, number 7, rapid breathing. Experiencing rapid breathing can be alarming, especially when it's linked to pneumonia. Let's break down why this happens in simple terms. When your lungs face an infection like pneumonia, the tiny air sacs, called alveoli, become inflamed and fill with fluid or pus. This buildup makes it harder for oxygen to move into your bloodstream and for carbon dioxide to exit. To cope, your body instinctively speeds up breathing to increase oxygen intake and expel carbon dioxide more efficiently. Additionally, certain nerve endings in the lungs, known as juxtacapillary or J receptors, play a role. These receptors detect changes like fluid accumulation and send signals to the brain to boost the breathing rate. This response is your body's way of trying to maintain proper oxygen levels during the infection. A study in the Principles and Practice of Pediatric Infectious Diseases, 2017, highlighted that individuals with pneumonia often exhibit rapid breathing as an early symptom. Recognizing this can lead to quicker diagnosis and treatment, improving recovery outcomes. In essence, rapid breathing during pneumonia is your body's natural response to ensure vital organs receive enough oxygen when lung function is compromised. Next, number 8, rapid heart rate. When battling pneumonia, your body mounts a defense against the invading pathogens, leading to inflammation in the lungs. This inflammatory response releases various substances, such as cytokines, into your bloodstream. These substances can affect your heart's function, often resulting in an increased heart rate, known as tachycardia. Additionally, fever, a common symptom of pneumonia, raises your body's metabolic demands. To meet these heightened energy needs, your heart pumps faster, contributing to a rapid heart rate. Moreover, the infection can disrupt the balance between oxygen supply and demand in your body. This imbalance prompts your heart to beat more quickly in an effort to circulate oxygen more efficiently. A study published in the journal Circulation in 2012 highlighted that patients with community-acquired pneumonia often experience cardiac complications, including tachycardia. The research emphasized the importance of monitoring heart health during pneumonia treatment to improve patient outcomes. Recognizing and managing a rapid heart rate during pneumonia is crucial. It not only reflects your body's response to infection, but also serves as an indicator of how well you're coping with the illness. If you or someone you know is dealing with pneumonia and notices a consistently elevated heart rate, it's essential to consult a healthcare professional. They can assess the situation and provide guidance to ensure both your heart and lungs are receiving the attention they need. Next, number 9, bluish lips or nails. When dealing with pneumonia, one might notice a bluish tint to the lips or nails. This change, known as cyanosis, indicates that the blood isn't carrying enough oxygen to these areas. In pneumonia, the air sacs in the lungs fill with fluid or pus, hindering oxygen from entering the bloodstream effectively. Consequently, areas with rich blood supply, like the lips and nails, may appear blue. A study published in the American Journal of Medicine highlighted that cyanosis arises when there's a significant drop in oxygen saturation, leading to increased levels of deoxygenated hemoglobin in the blood. This condition often accompanies severe respiratory issues, such as pneumonia. If you or someone you know observes this bluish discoloration during a respiratory illness, it's crucial to seek medical attention promptly. Cyanosis is a clear sign that the body isn't receiving adequate oxygen, and timely intervention is essential to address the underlying cause and restore proper oxygen levels. Next, number 10, confusion or delirium. Experiencing confusion or delirium during a pneumonia infection can be unsettling. This mental disorientation often stems from the body's response to the infection. When battling pneumonia, especially in severe cases, the body's immune system releases various chemicals to combat the invading pathogens. These chemicals, while targeting the infection, can also affect brain function, leading to symptoms like confusion or delirium. Moreover, pneumonia can impair the lungs' ability to oxygenate the blood effectively. Reduced oxygen levels mean less oxygen reaches the brain, which can disrupt normal cognitive functions and result in confusion. A study published in the Journal of Clinical Medicine in 2023 highlighted the gravity of this issue. The research found that among patients with severe pneumonia, those who developed delirium had a significantly higher risk of mortality compared to those without delirium. This underscores the importance of monitoring mental status in pneumonia patients, as early detection of delirium can be crucial for timely intervention. It's essential to recognize that confusion or delirium isn't just a minor side effect. It's a serious symptom that requires prompt medical attention. If you or a loved one with pneumonia starts to exhibit signs of confusion, it's imperative to contact a healthcare professional immediately. Next, number 11, wheezing. When the airways become inflamed and narrowed due to pneumonia, it can lead to wheezing, a high-pitched whistling sound during breathing. This occurs because the infection not only affects the lung tissues, but also irritates the bronchial tubes, causing them to constrict. Such constriction makes airflow turbulent, producing the characteristic wheezing noise. Recent studies have shed light on this phenomenon. Research published in the Journal of Scientific Reports in 2018 found that infants with neonatal pneumonia caused by co-infection of respiratory syncytial virus and bacteria like Staphylococcus aureus or Klebsiella pneumonia were more likely to experience recurrent wheezing episodes in early childhood. This suggests that certain pathogens can increase the risk of wheezing by causing more severe inflammation and airway hyperreactivity. Understanding this link emphasizes the importance of early detection and management of pneumonia to prevent long-term respiratory issues. If you or someone you know experiences wheezing alongside other pneumonia symptoms, it's crucial to seek medical attention promptly. Next, number 12, muscle pain. Experiencing muscle pain during a bout of pneumonia is more common than you might think. This discomfort stems from your body's immune response to the infection. When pathogens invade the lungs, your immune system releases substances called cytokines to combat them. These cytokines, while essential for fighting off the infection, can lead to inflammation throughout the body, including in your muscles, resulting in that familiar achy feeling. Viral pneumonias, such as those caused by the influenza virus, are particularly notorious for causing muscle aches. This is because viruses often trigger a more pronounced systemic immune response, leading to widespread inflammation and consequently muscle soreness. A recent study published in the Journal of Cachexia, Sarcopenia, and Muscle in 2018 delved deeper into this phenomenon. Researchers found that aspiration pneumonia can induce muscle atrophy in various muscle groups, including those involved in respiration, movement, and swallowing. The study highlighted that pro-inflammatory cytokines play a pivotal role in this process by activating pathways that break down muscle proteins, leading to muscle wasting and weakness. So if you're battling pneumonia and notice your muscles aching or feeling weaker than usual, it's a direct consequence of your body's fight against the infection. Recognizing this connection underscores the importance of comprehensive care and rehabilitation during recovery to restore muscle strength and overall health. Next, number 13, nausea and vomiting. Experiencing nausea and vomiting when dealing with pneumonia might seem unusual, but there's a clear connection. When the body fights off infections like pneumonia, it releases various chemicals to combat the invading pathogens. These chemicals can affect different parts of the body, including the digestive system, leading to feelings of nausea and the urge to vomit. Additionally, certain types of pneumonia, such as those caused by Mycoplasma pneumonia, are more likely to cause gastrointestinal symptoms. This means that alongside the typical respiratory issues, you might also experience stomach-related discomfort. Recent research has shed more light on this connection. A study published in the Journal of Clinical Medicine in 2023 found that patients with pneumococcal pneumonia who experienced nausea were more likely to have bacteria present in their bloodstream, a condition known as bacteremia. This suggests that nausea could be an indicator of a more severe infection. In essence, while pneumonia primarily affects the lungs, its impact can extend to other parts of the body, including the digestive system, leading to symptoms like nausea and vomiting. That's it for today's video. Pneumonia is serious, but awareness is the first step to prevention. Now you know the symptoms to watch for, so stay informed, stay healthy, and take action when needed. If this video helped you in any way, type "helpful" in the comments below. Your support motivates us to create more valuable content just like this. Don't forget to like, subscribe, and hit that notification bell so you never miss an important health update. Take care, and we'll see you in the next one.